This is a demonstration of how to perform a back massage on your patient. The reason why you should perform a back massage on your patient is to provide improvement of circulation, and it will also help the patient relax. If they are agitated, it will help them have a good night's sleep, and it's also a good opportunity for you to assess the back for any first signs of pressure ulcers, any signs of abrasions, any skin tears, or anything that's abnormal. For this procedure, you will need a towel, lotion, and a bath blanket. I will perform my beginning procedures. I will make sure to wash my hands, gather my supplies. I'll go to the patient's room, knock at the door. I will come in, introduce myself, and I also will identify my patient. I will tell the visitors to leave and provide privacy, and also explain the procedure to my patient. And also make sure that I raise the bed to a comfortable working height. So once I come into the patient's room, knock at the door. Hi, Joanne. I'm Marta. I'll be your nurse today. I need to give you a back massage. I need to raise the side rail. Now we raise the bed. I'm going to bring my supplies with me. For this procedure, you want to maintain as much privacy as possible. You don't need to wear gloves for this procedure unless the patient has any open sores on his back. You never want to massage any reddened area on the patient's back. So I could use my bath blanket to provide privacy, or I can keep the patient's blankets on and uncover only enough so I can roll my patient over to the side and keep the patient covered as much as possible. I'm going to make sure to cross his legs. And I'll let my patient know that on the count of 3, I will roll her over. 1, 2, and 3. I will adjust the pillow so my patient is comfortable. I immediately notice that my patient has a stage 1 pressure ulcer right on his coccyx. And so I need to make sure that I alert the nurses of this skin abnormality. I will expose the back and place a towel under my patient. I will now apply lotion to my hands, and I want to warm up the lotion on my hands before applying to the patient's skin. When you apply to the patient's skin, you want to start from the top of the buttocks and do long circles that would cover almost the whole entire back. So do long circular motion. You want to do this for 3 to 5 minutes unless the patient complains of pain or any discomfort. Then you're done with that. You can apply more lotion, warm up it in your hands, and then rub it on the patient's shoulders, doing small circular motion. As I reach the shoulders, I notice that on the patient's left shoulder there are 2 moles. These are 2 other things I should report to the nurses. Once I'm done massaging my patient, I will pat dry any excess lotion. I will roll the towel, ask my patient if she's feeling comfortable, cover my patient, make sure that there are no wrinkles on the linens, and I'll bring my patient back on a count of 3. 1, 2, and 3. I will align my patient in the middle of the bed and cross her legs. I'm going to fix the linens. Always make sure that your patient is presentable, that the bed is looking properly made. I need to do the corner of the bed, making sure that I do a mitred corner. Do a toe pleat. Make sure patient is comfortable. I will then lower the bed and give my patient her water, call light, and telephone. Make sure she's well and comfortable. I will do a safety check, remove any privacy measures, make sure that I do not leave the side rails on unless it is notified by the doctors. And I will leave the room and put away my equipment, wash my hands, let the visitors know they can come back, report and document.